My name is Abhay Gupta. I'm a board-certified plastic surgeon practicing in San Diego, and this is another edition of our Question of the Month feature on our website, www.guptaplasticsurgery.com, where visitors get to read a lot of information about plastic surgery, and if there's anything they're wondering about, submit a question, and every month we pick one of the more popular questions and give an answer. So hopefully dispel some of the myths there are out there about plastic surgery and answer any questions about new technology in plastic surgery as well. So this month's question is about laser liposuction. And a lot of people are wondering, what is laser liposuction? Is it better than regular liposuction? How is it different? So a good question, and something we certainly have a lot of experience here at Gupta Plastic Surgery with. We have a laser liposuction machine, and we certainly use it on a regular basis. So to understand what the difference is between laser liposuction and regular liposuction, let's start with what regular liposuction is. So regular liposuction involves, as it sounds, sucking out fat. So any unwanted areas of fat, we can suction the fat, thereby causing a much smoother, more tighter contour to an area. For example, the side of the hips, the waist, the bra line, we can suction excess fat and cause the skin to tighten and there get a slimmer, more leaner contour. How do we do that? Well, what we do is we first inject a mixture of fluid called Tumescent Infiltration. We inject this tumescent fluid into the fat. It contains three components. It has electrolyte fluid solution, which helps break up the fat planes and loosen up the fat tissue, and also replace some important electrolytes that are lost during liposuction. It contains local anesthesia, which is of course important for pain control, even after the procedure. And it contains epinephrine or adrenaline, and what that does is it causes the blood vessels to constrict, therefore less bleeding, and it limits bruising and swelling. Once that fluid is injected and it's given several minutes to work, then we perform the liposuction procedure. Now with standard liposuction, what we do is we make a small incision about 1/4 of an inch long, and we use a liposuction cannula, which looks something like this. It's hooked up to a suction machine by a handle and then a tubing that goes to the suction machine. And the tip of the cannula has several holes in the middle, at the end, that suctions out the fat as we treat. And what we do with the cannula is, through the small incision in the skin, we pass this underneath the skin into the fat and go back and forth with the cannula. And what that's doing is breaking up the fat cells, breaking up the little connective tissue bands between the fat cells, and at the same time, the suction machine is removing the fat. So it's a very efficient way of removing fat. It does produce better contour. The problem is the mechanical back and forth motion of using the cannula can generate significant trauma inside, which leads to pain, swelling, bruising, increased recovery time. So this is where laser liposuction comes in. What the laser allows us to do is allows us to remove that fat or treat the fat much more gently. And the same procedure is performed with the fluid infiltration to numb up the area and decrease bleeding. But then what's done instead is, through a very tiny incision, it's about 1 millimeter, this is what the laser looks like. It's a laser probe that's attached to the laser machine. This is inserted underneath the skin through a tiny little incision, and what the laser does then is we use the laser to heat up the fat and melt it. And instead of going vigorously back and forth with the cannula, like this, to break up the fat, the laser is done much more gentle, slowly back and forth, and it melts the fat as it goes. And therefore, we can treat that fat much gently than we do with regular liposuction, so there's much less bruising, much less swelling, much less bleeding, therefore much less pain and much shorter recovery time. Once that fat is all melted and liquefied, then we go in with our same liposuction cannula, and through the same small incision, but this time much more gently, just easily suck out that liquefied fat. It doesn't involve the same amount of back and forth trauma, and therefore less pain. So the advantage of liposuction is mainly the decreased recovery time, decreased swelling and pain. And in fact, we can do it under local anesthesia in an office setting, which is something that the Smart Lipo machine, for example, allows us to do here in the office without going to an operating room, without a general anesthetic, and a very quick 1 to 2 day recovery time. In fact, many of our patients have the procedure done and are able to drive themselves home. The other final added advantage of laser liposuction is, as a final step of the procedure, once we've melted the fat with the laser, we actually direct the laser up against the skin, underneath the skin. And what we can do is we can heat the undersurface of the skin. And when you apply heat to the undersurface of the skin will tighten. The collagen fibers will actually tighten. And what that does is it helps tighten the skin. So when we remove fat, you're left with extra skin. Well, the laser will help tighten the skin so it shrinks to the newer, slimmer you, and therefore improve your liposuction results and get a faster result. So we've seen, instead of the traditional liposuction, which takes 6 to 9 months or 9 months to a year really for a maximum skin tightening, the laser liposuction can do that same thing in 3 to 6 months. So it's certainly a very valuable tool in our armamentarium for treatment of unwanted fat and for liposuction. Something we're very excited to offer here at Gupta Plastic Surgery. Hopefully that answers your questions, and I look forward to reading your next questions for next month's submission. Thank you very much.